Now, another type of dementia is actually called vascular disease. Now, vascular disease has some parallels with Alzheimer's disease. Oftentimes, in terms of the symptoms, just how they're behaving, their memory scores, it's really hard to differentiate, like if it's Alzheimer's or vascular disease. So although it's a little bit less common, it's one of the things that needs to get ruled out anytime someone has a dementia. They need to rule out, could this be vascular disease? Now, the way that you can differentiate it, it's largely from a brain scan. In a brain scan, it will be evident that there's actually small areas of damage throughout the entire brain. So vascular disease involves a series, multiple circumscribed, meaning fairly small and contained cerebral infarcts. So these are mini strokes, and sometimes they get called transient ischemic attacks. And so it's a pattern of these mini strokes that cumulatively, so on their own, they don't cause that much damage, but cumulatively destroy neurons over, larger and larger brain regions as they continue to occur. And so the brain atrophy leads to behavioral impairments that, again, they resemble Alzheimer's disease. Now, the distinction here, I'm going to draw something on the screen here, where Alzheimer's disease tends to have a pattern where it goes like this in terms of functioning over time. So this is the horizontal is time, and this is the level of functioning. So over time, there's a pattern where it's decreasing. Now, vascular disease, it's a little bit differently. So you see here a gradual decline. In vascular disease, you talk about it as more as a stepwise decrease. So I'll draw it in a slightly different color. In vascular disease, it looks more like a staircase. And it also tends to be a little bit more rapid than Alzheimer's disease. So Alzheimer's disease, the decline is a little slower, a little bit more progressive, and in vascular disease, it tends to take just a few years before they decline to just not being able to show any kind of cognitive functioning, any kind of complex cognitive functioning. Okay, so vascular disease is fairly common, so I wanted to cover that. All right, so I will end there.